Hi, I'm Professor Krish Ragunath from the NIHR Nottingham Digest Diseases Biomedical Research Unit, Queen's Medical Centre, Nottingham University Hospital, Nottingham, United Kingdom. First of all, I would like to thank, on behalf of my co-authors, the editors of the GIE journal, for accepting our manuscript, Acetic Acid Chromoendoscopy for the diagnosis of early neoplasia and specialized intestinal metaplasia and Barrett's esophagus in meta-analysis. Dr. Gouldred first described this technique in 2001 when it was published in the journal GIE. This was based on his observation that gynecologists use this technique whilst they do a colposcopy to detect early neoplasia in the endocervix. I had the opportunity to meet Dr. Gouldred in a DDW meeting over 10 years ago in San Diego when he demonstrated this technique. Ever since I've been interested in acetic acid chromoendoscopy in Barrett's esophagus. When acetic acid is sprayed in the Barrett's epithelium, it makes the columnar epithelium more prominent, and it is due to a reaction called the aceto-white reaction. However, when there is dysplasia or early neoplasia, then it becomes a red reaction, and it is very obvious during endoscopy to notice the abnormal red area within the Barrett segment. I had a major interest in acetic acid chromoendoscopy for over 10 years now, and we published one of the first trials using this technique from the UK in 2006 in the journal Alimentary Pharmacology and Therapeutics. Here we clearly showed the benefit of using acetic acid chromoendoscopy over random biopsies in a cohort study. Since then, several endoscopists have used this technique worldwide, and more recently there have been a cost-effectiveness study as well from the UK. At this juncture, we felt that a meta-analysis is appropriate to summarize the results and also critically appraise the literature of this technique. We have included about 9 studies involving over 1,000 patients in this particular meta-analysis. The sensitivity and specificity of acetic acid chromoendoscopy to detect high-grade dysplasia and early neoplasia is over 90% from this meta-analysis. The ASGE PV statement, or in other words, the preservation and incorporation of valuable endoscopic innovations, states that for a new technique to supersede a standard technique, then the sensitivity should be over 90%, specificity should be more than 80%, and a negative predictive value of over 98%. If you look at these results from this meta-analysis, we can conclude that acetic acid chromoendoscopy nearly ticks all the boxes with regard to the PV statement. From this meta-analysis, we can conclude that acetic acid chromoendoscopy is ready for prime time to be used as an adjunct during Barrett's routine surveillance endoscopy. This technique is simple and can be performed by any endoscopist using standard endoscopy equipment, and it does not need any special training. What we now need is a randomized head-to-head trial with random 4-column biopsies to confirm the findings of the observational studies before we can conclude that random biopsies can be abandoned. Thank you.